Well, I'm here with Dr. Karen Minyard, your director of the Georgia Health Policy Center, some of our favorite friends in the field. And I know that you and your team have been thinking really carefully and watching really carefully of what's happening in Washington as resources are beginning to flow to communities that are really struggling and suffering through an immense disruption in life. And so maybe let's just start with that. Is what are you seeing as this moment of resources that are intended to help with the rescue?
Well, we just did a presentation that was titled From Famine to Feast, because there are so many resources that are becoming available. And I was thinking I would just give a little bit of an overview of what that money is and put it in a little bit of context. So we have the Consolidated Appropriations Act. That is the budget for 2021 plus the COVID relief. That's about $1 trillion. And then we have the American Rescue Plan Act, which is another almost $2 trillion. There's other money in the wings. There's the proposed 2022 budget, which has resources in it. There's the proposed infrastructure plan, and there's the proposed American Family Plan. All those together might cause this $3 trillion to be doubled or more. So if you go ahead.
No, and that money is going to start flowing, as you said, through different mechanisms, but it's going to keep flowing for years, right? I mean, how long does it take for this to happen?
Some of the money goes out 5 years. So some of it's 3 years, some of it's more immediate, some of it's 5 years. So it varies. And there's a lot of detail about what are the different buckets of money, who's eligible for them, who's eligible to partner for them. Are they going to the state? Are they going locally? So there's a lot of detail about that. And of course, as you get into thinking about this more, you'll probably want to delve deeply into the detail. And I'll say a little bit more about how we're thinking about that. But I wanted to put this money, this amount of money, this $3 trillion potentially doubled, into context. So when we had the tobacco settlement in 1998, that was $206 billion over 25 years. When we had the Great Recession, there was money in 2008, 2009, 2010, and part of it to go over the rest of a decade. And that money totaled $950 billion. So it was about a third of what we're seeing right now, and there's probably going to be more. For states, the money that they will get depends on their unemployment rates, and it's 5 to 20% of their 2020 state budget. So it's a significant amount of money that's going to be coming to states that they have the opportunity to make up for things that have happened and to do more. And in the local governments, there's a clause for the non-metro cities that says the amount that they are to get should not exceed 75% of their most recent budget. So you imagine if you're in an organization and you have an influx of 50% of your budget, particularly in these cities where this could happen, that's a lot of resource to think about what to do with. And even if it lasts for 5 years, which it would in the case of the cities, it's a lot to think about.
Yeah, and it's an interesting predicament that, we often say that the difficulty in this work is the scarcity of resources, but in this case, and with the prior examples of tobacco settlements and stimulus money, right? It's really, we are a wealthy nation that has a lot of assets. We have abundant resources in many ways. The question is, where do they flow and how do we make decisions about how to use it? So how do you see this beyond just the mechanics of resources that flow and the rules around that? How do you see the decision making and the practice change that's going to have to happen as people think about how to make the most of this, historic opportunity?
Well, as we've been thinking about this, we've been considering 4 principles. One is aligning efforts across sectors. That might be across healthcare, public health and social services, or across health and local governments, collaboratives, but aligning the resources. We've also thought about the importance of having a coordinated strategy. How can you think about what it is that you want to make happen and how you might weave together these resources to make it happen? And then there is the opportunity for intermediary organizations to help in situations where the state or local government might not have the capacity to do the kind of work that would need to be done around the money. And then there is this issue of being community respondent, thinking about the voice and leadership of communities driving the lasting change. We did some work with a group of surveillance partners that we have and our advisors. And we asked them to think about these principles and to tell us what they think is important. And they gave us a lot of ideas. And I tried to pull out some of the headlines from those ideas. So under this idea of aligning, the thing that they said is perhaps some of the greatest opportunities is with the cities and the counties, partnerships that might occur, pulling together with cities and counties or with cities and counties in the same areas. And that if that's done, the kinds of things that are important are accountability, thinking about partnerships that increase capacity so that there's more capacity there when it's over than there was to begin with, and that the private sector has a lot of opportunity for influencing the public sector. We have one example in Rhode Island where the Community Foundation has put together a comprehensive plan. They are influencing the government to implement the plan. When you think about this coordinated strategy, we were meeting with the National League of Cities, and one person on the Zoom went like this and said, "Everybody slow down." Because some of these funds have multiple up to 5-year windows, and we've gotten some of the money already, but more of it's coming later. There is an opportunity to pause, to take a breath, to look at what it is that's desired for outcome, and to think about how to weave together the money and create the partnerships in addition to the partnerships that are already there to make it happen. With the concept of the fiscal or intermediary organizations, one of the things is that the intermediary doesn't necessarily have to be the one that manages the money. There are other roles that are really important. One of those is being a convener. We just had a meeting with the Illinois Public Health Institute where they convened about 30 stakeholders in the state to talk about what is this money, what does it look like in Illinois, and what might they want to do together. So that convening opportunity is there, and also to be a guide for strategic planning is another opportunity for intermediaries. And then when you think about the community and the community leadership and having community folks involved in the lasting change, the big headline there was trust. And hopefully it's trust that's already built, but it could be trust that needs to be built in order for this to work well.
Yeah, the one of the predicaments, maybe almost the muscle memory that happens when resources become available, is the tendency to fraction them out to everybody, who's got a say, and the maneuvering that happens that maybe justifies almost anything that could be justifiable under it, and resources get spread thinly. What you're describing is a more patient, place-based, accountable stance that says we as a region, with the we to be built together in some ways, but that we can use this, almost with a sense of stewardship of both the resources, but a stewardship of the region in our direction. I know that you and your work have done a lot on the depth of what it means to step into a role of a steward. So how do you see this moment of moving from rescue, the mindset of rescue that says, let's just use this money and deploy it as fast as possible and give it to everybody who needs it, to one that pivots toward, long-term, persistent, equitable renewal?
Well, one good thing about this resource is that there's a lot of it. So if there is some of this, people spend the money on the things that come first to their mind or things that are their pet projects, it doesn't mean that all of the money needs to be spent that way. There's opportunity here to step in at any point and bring people together in a spirit of stewardship. And I think this idea of thinking forward to, we would be really proud if we look back, if we had accomplished these things. And we think a lot in terms of sustainability, resilience, accountability, and equity. And so how can we think about that, building that into the work? One of the things that we've been thinking about is this. First of all, there's analyzing, like, what is the money, where is the money, how much money? And that's a kind of a technical thing. It's pretty complex, but it's something that is pretty technical. But then there is, how do you translate that into something that is actionable? And how do you get into action? And one of the things that we've been contemplating is the idea of using the vital conditions for well-being as a framework to look at these resources. And last week I was having a briefing with our commissioner for public health, and our team took all of the money that was coming to Georgia and, as best they could, allocated it to the buckets of the vital conditions. And I wasn't sure how that was going to go, but it was interesting because in looking at that, she could see, oh, if I want to tackle something around lifelong learning, then my colleagues in the state government that are getting money are the Department of Early Learning, the Department of Education, and the university system. And so if you wanted to start with that, you could say, okay, here's the money, here's where it is. I think I'll get together with these other commissioners and I'll think about what it is that we might want to do with this. And the good thing about that is that being able to take different components of this and do something, it can be successful even in a state where maybe things are more conservative. Maybe the state might not be wanting to do a big overall plan, but there are some things that you could pick up and do and make a difference.
That's a great example of how, something this big, there's not going to be one table that, that orchestrates the whole thing. There's going to be no quarterback for using trillions of dollars. But at the same time, if there are bridging mechanisms and things that are built to be attractive across areas of, organizational expertise and boundaries, then it ends up being more of a cohesive investment in the conditions for well-being and equity. And in that way, the resources become multi-solvers, right? They bring people together outside of what there might be their typical program and organizational boundaries to have a more unified focus on securing these vital conditions. It's a great story.
So you could bring together a few people who are stewardship minded, and you could look at what your desires are and what the resources are, and you could look at where do the resources, the desires, and the people match, and then you can begin investing, and then you can do it multiple times. I think you're right that it isn't going to be some big plan and it's all going to get implemented. It's going to be something where there's an opportunity. And I like what you said about the urge to invest in the kind of the top of mind project versus thinking as a steward of where we want to get in the future. But that's the opportunity that we have. And even if we do that over and over in small ways, it's going to roll up into something that is better for us than it would have been if we hadn't done that.
My last question is, do you think there's going to be a way for people to learn from counterparts in other places over time? Is there going to be a kind of knowledge sharing mechanism for those who are thinking in these ways, but all in different places, different contexts?
Well, that's part of that third component where I was talking about being in action. So right now, on a daily basis, we are collecting state and local plans as fast as we can and cataloging them, and perhaps connecting people, or at least sharing, here are 3 plans that might be relevant for what you're trying to do. We were talking a little bit about if you're in a conservative state, then you might want to talk to somebody else who's in a similar kind of environment. And so we are putting together those plans. That's a simple part, one part of it, but we also are thinking about what are the tools that would help people be able to move faster and more effectively in this action part. More to come on that as we develop it later this summer, but there'll be more that can support the development of the plans and weaving things together to make a difference.
Yeah. One of the beautiful things about this moment is it's going to be action learning, and the action's going to happen one way or another. The question is, what are we learning about it? And you invoked the prior history of how did we use the tobacco settlement? How do we know we benefited from the way that those choices were made? Stewards before us have made these decisions as well. And the question is, what happens on the watch of the people and organizations that are thinking about it now? Well, thank you so much for spending time, this moment today and sharing your perspective with the colleagues in the stewardship labs. But more importantly, thank you to you and the whole team for doing some of the groundwork and thinking about what this can be for the nation.
Well, thank you for having me.